February is American Heart Month, a time when the country shines a spotlight on heart disease, which is the #1 killer of Americans. It's also a time to understand your risk factors and to make changes so you can start living a heart-healthy lifestyle. And joining us to talk about the warning signs of heart disease and strategies to maintain a healthy heart is Kaiser Permanente San Diego cardiologist Dr. Jeff Cavendish. Welcome.
Thank you. Good morning, Laura. How are you?
Fantastic. Thank you. Doctor, every year some 647,000 Americans die from heart disease, which is why knowing the early warning signs of a heart attack could mean the difference between life and death. What symptoms should we be aware of, and when should we seek medical attention?
Yeah, great question. Very important. The big symptoms that we feel: pressure, discomfort, squeezing, tightness in the chest. That's the main concerning symptom. We can feel that tightness, squeezing come up into our neck, into our jaw, maybe into the left shoulder, through to the back. It's a very uncomfortable, oppressive feeling. So anything like that that develops, definitely very concerning, that you should probably call a loved one, if someone's around, or if it's really, really bad, call 911. You might start getting out of breath. You can't take a deep breath. You might feel lightheaded. You might feel like you might pass out. So all of those things are very, very concerning. And we really strongly recommend, getting to medical attention as soon as possible.
Now, can you talk to us about advancements and how treatment has evolved? Do most heart attack patients require surgery?
No, it's amazing what we've seen over the last. I've been doing this for almost 25 years now, and the advances are incredible. Patients who are having heart attacks now come into the emergency room. We identify them very quickly, and then we do an angiogram. We basically go through the wrist artery. We put a little catheter in the artery in the wrist. We go into the heart. We do an angiogram that maps out the heart arteries. We see the blockage. We clear out the blockage with little balloons and put stents in the heart, and basically abort the heart attack, stop the heart attack, and we know that that's saving lives. And we're doing this every day.
All right, let's talk prevention. There are plenty of ways to reduce your risk of heart disease and promote a healthy heart. Can you break down your top strategies?
Yeah, the big things I think are getting a checkup, going to your doctor, checking your blood pressure, checking your cholesterol, and then if you're doing some things that are not very healthy, like smoking cigarettes, stop doing that. Losing a little weight, 5 or 10 pounds, exercising a few days a week, ideally every day, 30, 40 minutes. Those are huge factors that can help us. Some of us have just bad genes, and sometimes we know that, sometimes we don't. But getting in and getting an assessment of your risk factors, if you have high blood pressure, if you have high cholesterol, if you have diabetes, if you smoke cigarettes, and then hopefully modifying all those risk factors. Things we can do ourselves at home: getting better sleep, eating healthier, certainly looking at labels, seeing what has very high sugar content, high salt content. If you're prescribed medications for various problems like diabetes, high cholesterol, high blood pressure, take those medications. And then getting routine evaluations once a year or so.
Small lifestyle changes can make a big difference in lowering your risk. To learn more, visit kp.org/San Diego. Doctor, we thank you so much for this valuable and potentially life-saving information.
My pleasure. It's been great.
And we thank you for joining us on San Diego Living. We'll see you next time.